Hello, and welcome to this episode of NHIS in a Week. Here, we give you happenings and insights of the authority and the scheme. My name is Bridget Apia. Now, the headlines NHIA calls for collaboration to tackle illegal charges and claims. NHIA targets 80% membership coverage. NHIA Claims Directorate builds staff capacity in claims management. Now to our first story. The NHIA Chief Executive, Dr. Victor Asari Bampo, has urged Ghana Health Service District Directors to help curb fraudulent claims and illegal charges. He warned that these practices threaten the smooth implementation of the reviewed NHIS tariff regime.
Addressing the 32nd Annual Conference of District Directors of Health in Kumasi, Dr. Bampo stressed that introducing the new tariff without tackling systemic loopholes would be like pouring water into a basket. He announced that the NHIA has cleared all outstanding arrears since 2018, thanks to government's decision to uncap the NHIL and release funds directly to the authority.
You may have noticed that over the past 8 months or so, the NHIS, thanks to the government of Ghana and the Ministry of Finance, is making monthly payments. We think government has shown a lot of commitment in terms of providing financing for the scheme. And we are making even monthly payments when it comes to reinvestments, and we hope that it will continue.
Dr. Bampo, however, expressed concern about illegal out-of-pocket charges and fraudulent claims, warning that such practices erode public trust. He called for stronger collaboration with Ghana Health Service, noting that protecting the scheme rests on the golden tripod of providers, financiers, and the people served. Highlighting recent progress, he revealed the NHIS membership is nearing 20 million, covering 95% of all diseases conditions, with digital innovations like the star 929 hash renewal code and the My NHIS app driving accessibility. He reaffirmed NHIA's commitment to transparency, efficiency, and upcoming policies such as free primary health care and Mahama Cares, which together will advance universal health coverage.
Moving on, the NHIA is targeting 80% membership coverage under its next medium-term strategic plan for 2026 to 2029. Deputy CEO of Operations, Dr. Senanu Jokoto, announced this at the first meeting of the Technical Working Group in Accra.
Dr. Senanu Jokoto said the plan builds on ongoing reforms and will leverage the Free Primary Healthcare Initiative to push Ghana closer to full coverage.
We have a new direction, a new vision, new things are coming up on board. The free primary health care is more or less going to redefine some of our operations. We are looking at having minimum of 80% membership coverage within this period.
He described the planning exercise as critical to the Chief Executive, the NHIA board, and the institution at large.
This is an extremely important exercise for the CEO, Dr. Victor Bampo, and for the board. So I implore all of you to put in your best.
The TWG will review the 2022-2025 plan, assess directorate performance, and propose improvements with guidance from the NDPC. Other acting directors urged SWOT analysis, stakeholder consultations, and alignment with global health trends. Mr. Suleimana Abbas, Director of Research, Planning, Monitoring and Evaluation, emphasized executive management's priorities, thus, free primary healthcare, boosting membership, and ending illegal charges. Dr. Jokoto closed by urging the group to deliver the plan by year's end, calling it a vital step in strengthening NHIA's vision.
The NHIA Claims Directorate has started a 4-day intensive training for staff of the Claims Processing Center in Accra. The program, supported by the World Bank, aims to improve efficiency and transparency in claims handling.
The first batch included CPC Accra staff, actuarial officers, and district managers from Greater Accra. Training covered e-claim systems, conflict resolution, claims verification, and ethics. Acting Claims Director Dr. Abigail Nyakukuju Dechi-Kwarteng stressed the central role of accurate claims management in sustaining the scheme. Sessions also tackled clinical appropriateness, conflict management, matrimonial issues under Ghanaian law, and updates on guidelines. On day 2, staff were introduced to a patient call-out feature for better verification, while Acting Director of Operations, Ms. Maria Musa, outlined NHIA's priorities: free primary health care, eliminating fraud, and staff welfare. She also announced the adoption of AI and fraud detection systems in claims management. The training continues with more batches to ensure nationwide standardization and stronger staff capacity.
Moving on to the Ashanti region, the NHIA's regional office has presented its third quarter performance at a Kumasi Metropolitan Assembly stakeholders meeting. The session gave agencies an opportunity to review progress and share outlooks for the rest of the year.
Acting Regional Director Mr. Muniru Muhammad Muntaka highlighted membership registration, mobile renewals, and indigent enrollments. He stressed the NHIS mobile renewal platform, My NHIS app, and star 929 hash as convenient tools for members. Mr. Muniru reassured stakeholders that the authority remains financially sound, with all arrears cleared and timely payments in place. He also confirmed measures like mystery shopping are being deployed to eliminate illegal charges at facilities. Stakeholders praised the app demonstration, describing it as simple and user-friendly, and commended NHI's efforts towards UHC by 2030.
Also in the Northern region, the NHIA office has recorded nearly 16,000 new enrollments and renewals during the 2025 Damba Festival. The exercise was conducted in collaboration with the Dagbon Traditional Council.
A task force led by Acting Regional Director Mr. Alhassan Abdullahi worked with chiefs palaces across Yindi, Bembela, Bulensi, and other areas. The teams registered 2,335 fresh members and renewed 13,472 existing cards. Festival goers were also educated on NHIS benefits, My NHIS app, mobile renewals, and linking Ghana cards. Mr. Abdullah hailed the achievement and urged district teams to sustain the momentum to meet annual targets.
Now to our last story. The NHI's One Municipal Office has capitalized on this year's Damba Festival to register and renew thousands of members. Registration centers were set up at the Nas Palace and surrounding communities.
The Upper West Regional Office, led by Acting Regional Director Mr. Rashid Tindogo Mohammed, monitored the exercise alongside regional officers. Community members were educated on renewals, the My NHIS app, Ghana card linkage, and indigent enrollment. Mr. Tindogo encouraged members to renew promptly to avoid waiting periods and urged the public to always demand receipts and report illegal charges. He reaffirmed executive management's commitment to ending co-payments and illegal fees under the scheme. While Municipal Manager Mr. Abbas Abdullahi assured that outreach will continue beyond the festival to expand access across the municipality.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes, you can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier. National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
Thank you for watching this week's episode of NHIS in a Week. For more stories, do log on onto our website on www.nhis.gov.gh and do visit our social media platforms displayed on the screen. Thank you for watching. My name is Bridget Appiah.